action.
I am not very
That was
good at
completely unscripted.
Oh.
So, boys and girls, this is our second video today because initially we were going to be held out on a transfer and go get some of our favorite food from down south.
Some food.
Food, oh
Yeah, broiling.
We're doing a commercial
crab.
for the Boiling Crab. When in LA, there are several locations. One's close to you.
We like the one in Koreatown.
Koreatown, the best.
That's the only
boiling
one
crab.
we've gone to.
The
but
Boiling Crab. It sounds ridiculous.
Fucking
It's a chain.
tasty.
It will freaking change you.
Yeah.
So goddamn delicious. You have any questions? You send me Boiling Crab. We appreciate a gift card for the plug.
Oh, at least like $200 a piece. I will blow
We'll
through that.
spend it. We'll double that in our spending of the crab. Anyway, so we made a video earlier, and I forgot what the hell we even talked about. But
I don't know.
yeah, I don't know. It probably wasn't that important. We were kind of upset when we did it. And what are you doing there, Skins?
Oh, I got the shits. But I'm a trooper. I'm still here.
So as we said, we
Doesn't smell very C. diffy yet.
let's see, Diffy. We wanted to make a video about stuff you'll be taking. We brought some things, but the lighting isn't that good, and we've been kind of bouncing around town. So I don't know if we'll get to do a video on what people tend to want to know what they should take to clinicals. But anyways, we thought, you know what, we're here. We can talk. Shoot it, hit it. Don't be a sissy. We thought we'd do a video on things to kind of expect when you get to clinicals, because one of our biggest things that we were always running our mouths about right before class started was, or the whole course started, was is it good?
No, it's very chalky.
Was that we were like, I don't want to give baths, I don't want to wipe butts, I don't want to do that. Like that, just like, not that it was like it was beneath us, but
It's
like
not,
we deal with
who
it.
wants to do that?
Nobody wants to do that. And it was like, oh, it's gross and and because when we get somebody that craps themselves in the ambulance, guess what? We wrap them tight like a burrito, code brown, and the nurses look at us like, you couldn't clean them. It's like, what do you want us to clean them up with, man? What do you want us to do?
Hopes and dreams.
Yes, we use spiritual bliss. So just to kind of give you guys a heads up, I think a lot of other people have asked us that we knew that were coming into the program. We're like, what's like the worst thing, like what should we watch out for and stuff. So we thought, yeah, there's a lot of things we could give you advice on, like, oh, watch out for this, make sure you do this. But a lot of the passed over things are the gross stuff that you're going to see and deal with, and to kind of mentally prepare you. So like one of the first things you do is sick people especially tend to flake.
Oh, yeah.
They tend to have body dandruff, for lack of a better term.
Skin flakes.
Skin flakes. It looks like somebody, have you ever gotten a box of those instant mashed potatoes and sprinkle it all over your bed? That is what you're going to be dealing with.
They should practice with that. You should practice with that. Put that on a bed, lay in it, and then have
try not to make a mess.
Yeah.
Have somebody else lay in it, and you try to clean it up without that going aerosol.
So do not wear chapstick at all whatsoever. If your lips are cracked, so be it. Do not freaking wear
no
chapstick.
lip gloss.
Yeah.
Anything that's really sticky, because that stuff aerosol, the moment they move, you just poof.
Yeah, and it's on you, and you're like,
you'll see someone with a stuck piece of dead skin to their lips that's not theirs, and you're just like, go wash your mouth with iodine right now.
Yeah,
like,
don't do it.
You're gonna get it. Like, and don't. So when you're moving, especially the elderly, it's with her. Be careful, man. Number one, breathe through your nose. Don't open your mouth, and keep your mouth shut, because it's gonna go in your mouth. We're getting flashbacks. She's already gonna gag thinking about it. And you move very slow. There's none of this like whipping stuff around, popping sheets, whatever, or cheeks, because that is going everywhere.
Yeah.
And people that are, maybe people in your class are at the same level, will be like, that's funny, or pissed. Staff will be pissed that you put that shit in the air. Okay.
Yeah, don't do it.
Yeah.
You're gonna see a lot of turds.
You're a lot of
bed turds.
Nurses. When you go to nurses, you're gonna laugh on how much people are into poop. Like, it's just all about the poop.
Oh, sorry. Were you there for my last patient, the yellow highlighter woman?
Yes.
Hairy buttholes are a real thing.
You guys got juicy as hell right now. You got that pre-vomit lube going on.
I was like, while I was wiping, you see me doing this number.
It's like you look like a dog humping the air.
No, it was literally like how they say, like,
I wish you could get a close up your eyes.
Shit stuck in a shag carpet. That's what it was like.
That's real. She's not acting. Trust me, because even I'm a little. Because you start flashing. We just ate a lot, and so I'm like, I'm gonna vomit right now. You want some ranch, some ketchup?
It was like hard. It was like one of those like ice creams that were hard on the outside, and then it was like
a shell.
A shell.
You're gonna see a lot, because what happens is these people are laying in these beds, especially these older geriatric people that are really sick, and some people that just don't want to they want to be catered to. They want to be like, I want to lay here. As sad it is, but it's very true. They want to lay there and they want to be catered to. They want to be pampered. They just want to lay there, poop, pee themselves, and somebody come up and clean them up. It's some psychological thing. But when you turn these patients over, you have linen and you have a chuck bed and you have this Skid Row, man. That is just like.
And when you turn them over, they will fart on you.
You're gonna, because you're moving their gut, and you're like, and you're just like, Jesus Christ. Like, and it's not even like we can laugh now, but when it happens, now, okay, if you're the one that the cheeks are facing, you're not laughing. The other people are spazzing because they're laughing so goddamn, but trying to be courteous to the patient.
Yeah,
you know,
it's always about patient comfort. And they'll even say, "Oh, I'm sorry, I didn't even know that was gonna come out." Like, it's because it's true. Like, they don't realize it's gonna happen.
And then when the fight is, they hear, it's like, you pushed, because there was a sigh of relief. Like, finally, I've been waiting for an hour to get that out. Thank God you were there. But you'll see skin marks, and man, it's poop. For a person that's got a disease process, so they've got those sick shits.
The medication.
And then the medications, what they're intaking, the hospital food makes you stink. Just the reality of it. And, oh my God, dude, it's enough to just make you, because you'll...
Oh, little tricks, put, Vicks.
Vicks. Like, it's, okay, what you do is, my trick is, when we picked up one, is, okay, you go get a thing of Vicks. It's about yay big, right? Now, there's a couple weird things to do it, but primarily what we take is those little pill keychains. You'll just sit there, melt the thing down, and pour a little bit in there. That way you can just dab a finger. Yeah. Keep it with you, man. Like, stick it in your pocket. Do something. If you can find little packets of Vicks, which I'm sure they sell very expensively, dude, it helps so much. Just a little to take the edge off the stench.
What I've seen some people do, too, is they'll take, like, alcohol preps and just wipe their
and just like, I don't care if I get high.
I don't know if I want to do that.
Not the smartest thing to do, but it, like, dude, some of them are so incredibly nasty.
It's like...
the food, but maybe like
it's kind of like, I don't know, maybe I'd rather just smell alcohol rather than some body odor. Especially if they haven't laid or if they've been laying there for
like
a while.
Really big people that have skin folds and creases and stuff, they get this juice. They build this. Yeah, it's
really odd, and then you'll stir it up, so it's kind of like you have to double bathe them.
Yeah, and especially people that have like liver issues.
Bring a ton of towels.
Okay, look, you're gonna get bed. Like, gross thing you're gonna have to do is you're gonna have to change beds. You're gonna have to change diapers that are full of shit. You're gonna have we're fat. This nation is freaking fat. Okay, that's just the reality of it. I'm not bagging on anybody because I am no Slender Reed, but but the reality is that people are huge, and when you got to give a bed bath, number one, it's not the most pleasant smell, but the people by and far have been very appreciative. Yes. When you give them a bath, they're just like, thank you,
one of those,
thank you.
Being a human, making them feel like a human rather than just
like,
a room number or.
And they are. You're gonna see, and anybody that's watching this does it. You're gonna see people that thank you so much. I feel better having a bath.
Even just washing their face or brushing their teeth. Something simple like that.
One of those things that you don't ever think about till you see it, and you're just like, wow, man, it made a difference. That little stupid thing.
Always have somebody in there with you.
With what? Giving a bath.
Yeah, giving a bath.
You're gonna give baths. We'll give you this piece of advice. Bring plenty of towels. You're going to learn how to give a bath. Bring plenty of towels. Washcloths. So bring double of everything you thought you should have. Yep. Because you don't want to like, oh crap, we didn't bring this. Make sure, go through your mind, because you know what, dude? It's going to smell, and you don't want to be in there. Never give a bath alone. Especially if a student, man. Don't ever do it alone, because you're going to end up in trouble. Something's going to go south on you. But yeah, just like, you're going to end up with some stinky stuff. People puke. You're gonna get puked on. You're gonna get cough. Don't talk to people in their faces. Yeah. Don't ever do that, man. Like, if people are talking, always be conscious about how you are, because all of a sudden they'll cough and right in your face, man. Like, so they'll sneeze in your face.
Always stand to the side.
Yeah,
don't
and just
stand
be like,
directly in front of them.
And always kind of like maybe stand to them and talk to them like, that way you can quickly do this number. If they get you, but at least they can go in your eyes and mouth. Okay. What else? A lot of people are touchy. Wear gloves, man. Like, just tell people, like, and if they always like, well, I don't have anything. Some people get insulted by it.
Then you could just say, well, what if I had something?
Yeah, it's like, look, I'm dealing with a lot of patients. I don't want to give you something. I like you, you know, like, because these people, they're not conscious and a lot conscious of what's going on, but they'll be scratching, digging in certain place, whatever, and people will have poop under their fingernails, and they go to touch you, and some old lady will be like, oh, you're so sweet, and touch you with feces on their hand. It's not a joke. It happens very often.
And they just don't realize it.
Yeah, they're just like, they like you and stuff. They're just not thinking about it. It's not, you know, just, but you're gonna get sick, man. Like, you need to be careful. Watch out for yourself. Some other gross stuff we gotta tell them to watch out for. Pee smells, poop smells, vomit smells.
Oh, lung butter.
Lung butter. People cough when they have cancer, or especially cancerous lung cancer patients. Lung butter, the mucus, the productive phlegm that comes up when they're coughing has a very distinct odor, and it's very much it looks like, if you've ever made those little cinnamon buns that you pop and the thing frightens you, stresses you out a little bit, the frosting that comes with, if you warm that up and do that, that's the color and kind of consists of this stuff. It's just this, and it's got an odor that just will make you gag.
All right, that's enough. That's enough for today.
Okay, next video, we don't know what we're gonna be doing. Please.
I like Android. I like the Samsung.
Samsung, yeah, maybe come with the S8. We love it.
Samsung 8 or whatever.
If you guys have any questions, hit us up. We'll write as soon as possible. Answer your questions. Give us any ideas of what we want to explain. As I said, we are third semester students.
Almost there.
Almost there, man.
Light is at the end of the
At least
tunnel.
I hope I don't fuck it up this year.
We're not gonna fuck it up.
But let us know if you have any questions, like and subscribe, whatever.
Subscribe.
And we'll get back to you. Thank you so much.
Like and describe.
I like him to describe it.